Upon reaching the patient, remove the lid of the AED Plus and turn it on. Follow the audio and visual prompts through each stage of the life support process. An LED light will indicate which step you should focus on.
Check responsiveness.
Fred! Squeeze my hand, Fred. Can you hear me?
Call for help.
Sharp, call an ambulance.
Open airway. Check breathing.
Look for rise and fall of the victim's chest. Listen for effective breathing coming from the nose or mouth. If desired, the lid of the AED Plus can be placed behind the victim's shoulders. This will help support and maintain an open airway. However, you should not use the lid as a support if you suspect the victim has a spinal injury.
Attach defib pads to patient's bare chest.
Use the scissors from the ready kit to cut the victim's clothing to expose their bare chest. Tear open the electrode pack and unfold the electrode pads. The CPRD pads are one-piece pads that are easy to place. Using the sensor's crosshairs to guide you, align the CPR landmark between the victim's nipples and the middle of their breastbone. Press the CPR landmark with your right hand and pull the number 2 tab to peel the protective backing from the electrode. Press the electrode from the center out to make sure it adheres properly to the victim's skin. Repeat the action on the lower pad marked with the number 3 tab. If the patient is large, you will need to tear away the lower pad at the perforated line and extend it before pulling the number 3 tab. Instructions on the electrode pack remind you how to attach the electrodes to the victim. Once the pads are applied, the AED Plus will automatically analyse the victim's heart rhythm.
Analyzing.
You should not touch the patient at this point, and the AED Plus will remind you of this.
Don't touch patient. Analyzing.
In some situations, the early stages of the life support process may have been started before you arrive with the AED. In this instance, you can attach the electrode pads to the chest prior to switching on the AED Plus.
Adult pads.
After powering on, the AED will jump straight to the analysis stage in order to save time. This enables you to deliver therapy and CPR treatment faster.